The doctor's in, and today we are discussing vaccinations. Think you don't need immunizations against infectious diseases? Think again. Dr. Scot Ackerman, one of the First Coast's leading doctors, is joining us today to explain the importance of keeping yourself and your children safe, up to date with vaccines. Dr. Ackerman, thank you so much for being here. We appreciate it. It's been in the news. There's a lot of controversy for some surrounding vaccines and vaccinations, so we're going to start out very simply by talking about how do vaccines work?
Well, vaccines protect our immune system against attacks by disease. And they really kind of energize our immune system so that our bodies can attack viruses and bacteria that we may be exposed to. So these vaccines are made from a weakened or killed pathogen. A pathogen would be either a virus or a bacteria. They're not really strong enough to make you sick, but they are strong enough for your immune system to identify them as such and generate antibodies. The antibodies will be within your body. So as a result, because you have these antibodies within your system, you gain immunity against certain diseases that you're vaccinated against. So if you're ever exposed to the disease in the non-attenuated or the full-strength disease, your immune system will recognize it immediately and be able to fight it off.
So how effective are these vaccines?
Well, the vaccines are designed to generate an immune response, but individuals' immune response systems are all different. And some people may not generate an adequate response if they have some sort of suppression of their immune system. But that being said, vaccines are very, very highly effective, probably 90 to 100% of the time. But you have to be careful because we talked about a few months ago when during the beginning of flu season, I talked to you about the flu vaccine.
Sure.
So the flu vaccine only protects against certain strains of the influenza virus. So if you get the flu vaccine, doesn't mean you're not going to get the flu. You're just not going to get one of those strains that it protects you against. We try to identify what strain of the influenza virus is coming around every year, and vaccines are developed for that strain. But there could be a variant of that strain that you may still be susceptible to. The same goes true with some other vaccines as well, that there could be a variant of the disease that you're not vaccinated for, so that you can still get that disease. But generally speaking, vaccines can give you immunity for 80 to 90% of the time.
Okay, and this, for children, how many vaccines are recommended for childhood? Here, and I know that there was a lot of conversation about do vaccinations, are they linked to autism? I mean, we can get into that in a second, but how many vaccinations are recommended during your childhood?
So we recommend currently, and it changes over time, but we recommend currently that children get vaccinated for 14 different diseases, and they get those vaccinations between birth and 6 years. Now, that doesn't mean they're going to get 14 shots, because some of the vaccines are multiple. They get measles, mumps, and rubella are in one. That's 3.
The MMR, as everybody remembers.
Exactly,
yeah,
MMR.
MMR shots.
And some parents worry about giving too many vaccines, especially for diseases that are rare. But the point is that because we are vaccinate society, that's why these diseases are rare. And we hope to be able to eliminate diseases by vaccinating all of society. For example, smallpox. Smallpox has been eradicated, and vaccinations are no longer needed. But not when I was a kid, but a little bit before I was a child, people were routinely vaccinated for smallpox, and you may see some older people still have a scar on their arm. That's a telltale scar. That was a smallpox vaccine. That vaccine is no longer needed because everyone was vaccinated for it, and the disease was eradicated.
So by vaccinating yourself, you're not only protecting yourself, but you're protecting, theoretically, the community as well.
Right. So being vaccinated protects those you care about and prevents the spread of disease. And we call this something called community immunity. And that happens when a critical mass, a critical portion of the community is vaccinated, and so most of the members are protected, and there's little chance for an outbreak. Once you reach that level, then the whole community is pretty much protected from that disease. If you don't reach that level, that's why there's always a push to get everybody vaccinated for the flu, because once you get enough people vaccinated, even those few that don't get vaccinated, they'll be protected as well.
All right, and let's talk about how safe these vaccines are. A lot of people concerned with the side effects, one, and then also, let me just touch upon the autism scare that there had been with children, young children getting vaccines, and the fear of linking that to autism.
So there are side effects to vaccines. Most commonly, they're just short-lived, and they're in the area where you get vaccinated. So you may get some pain or swelling, in the arm, in the site where you receive in the injection site. Sometimes patients get a fever or a headache after that, but the risk of the serious harm is very, very small. And vaccines are constantly being evaluated and monitored for safety, and they're being tweaked to make sure that they're safe. The issue regarding autism and those sort of things, there has not been any studies that have linked autism to vaccinations. There's some anecdotal thoughts that there might be a relationship, but there really is no study to link that or to link any real serious diseases to vaccinations these days.
All right, Dr. Ackerman, thank you so much, sir, for being here as always, and for coming on and sponsoring the segment, and for the helpful advice. For questions regarding today's topic, any other health questions that you might have, you can connect with Dr. Ackerman on his Facebook page by visiting facebook.com/First Coast Oncology.